Hello, good evening, everyone. My name is Eunice. Welcome to our webinar today. So, our webinar, the title of today is The Mindful Hour, the Positive Body Image in Cancer Recovery. So, now let's quickly invite my partner today, Jefferson, to introduce our webinar today.
Hello, hi Eunice. Oh my God, I miss coming into to our live webinar. It's like
Yeah,
I always be excited to do our live webinar. It's like forever since our last one.
yeah, right. It was, when
Mm.
was it? The last
I
one.
mean, the last one that I did was like 4 months back, but with you was like so long ago. I think it's in
Yeah,
early January, kan. This year, right, we start off the year with self-care toolkit, if I can remember.
yes.
My
I
God, how
think
have you been, Eunice?
well, I think I'm doing good. After applying the self care toolkit in my life, I've
Oh
been
wow.
doing great.
Right. I still remember you're a person who likes smell, is it? Scented
Yes,
candles and okay.
good memory.
Mm. Right, okay, wow. I mean we forgot to introduce who Eunice is in NCSM. She's
Oh
our
yeah,
clinical psychologist, yeah.
yes, of course, right? Yeah, so I'm
Right.
the sessional clinical psychologist from the
Mm,
National Cancer Society of Malaysia, and
mm.
here we are, Jefferson, our in-house clinical psychologist, right?
Yes. I believe a lot of people know who I am. And for
Yeah.
those who don't know, those who are still new here, welcome everyone. Yes, like as Eunice mentioned, I'm a clinical psychologist working in NCSM as well. Mm.
So I guess both of us are very suitable for today's topic because in our working experience, we did see a lot of clients,
Mm.
or cancer patients and their caregivers for
Mm.
different topics. But I think the topic of today, the body image, is something we don't really say in the room, right?
Yep. And I
Mm.
think it's something that the society doesn't want to talk about even. Because something bigger, so-called bigger, is actually overshadowing what body image is really.
Yes,
And
agree
it's
with that.
such an impact to anyone affected by cancer.
Agree. All right,
Mm.
so should we start now?
Yes, of course. So take it
Okay,
away, Eunice.
okay. All right, great. So, for today's webinar, so we will be talking about the how the positive body image will actually works in the cancer recovery. So let's quickly show you what we will be covering today. So today we will be covering the webinar. Will be covering the body image changes, the emotional impact of all the body image changes, the so we will also teach you how to embrace identity beyond appearance, and lastly, Jefferson and I, we will be talking about maybe we can talk about the topic for today, how our work actually can help with the body image, and people who are suffering from having they think they must have a good body image to show, to be present in the society. So we will be starting on with the first topic, which is the body image changes. So okay, so let's talk about what is body image. So for me, working in this field, I think the definition for body image is actually the way that you perceive yourself, because your body image can mean many different things. So for us, body image can be the picture in our mind of how our body looks and works. So it is how we think and feel about our bodies and how we believe others see us. So if you can see from the definition, body image actually link very much to the feeling of self-worth. So if anything, if you see body image as a very important element in your life, then anything get wrong or get right with your body image, your self-worth might be affected. And it is also different from everyone. We have different body image concern. Some of them, they might have the concern of hair loss. Some of them, they might have the concern of body weight. Okay, then people might find, if they don't look different, they feel different, because of some treatment. So next, we're going to see what are some of the changes of the of your body image when you are going through the cancer journey, or your loved ones when they are going through cancer journey. So if we can see, we can actually differentiate all these body changes into the obvious one and the not obvious one. So if you can see, the obvious one will be maybe the removal of your body parts and a use of a prosthesis, all right? And then the visible scars and skin tightness. These are all, and of course, hair loss and hair growing back differently. These are some of the body changes that are quite obvious. You know, when, for example, hair loss, you might lose some or all of the hair from your head, and sometimes from your eyebrows and eyelashes and your body hair. So these are all like some of the obvious physical changes in your body. And of course, we will be looking at the other type of physical changes, but they are not really obvious one. For example, um, you feel that you were having like losing weight, you know, putting on weight, or you will having like bowel or bladder change, or you even have changes in sex life and intimacy. So the changes in your sex life and intimacy, it's some of the changes that are not feasible. So other than that, you might also feel tired sometimes, or you might feel weak or unable to do activity that you did before the treatment. So, but some of you might experience like late treatment effects, you know, that change the way your bladder or bowel work. So all these changes are very important because they did bring some effects into your life. Maybe most of us we will see all these changes as bad. You know, we might feel difficult to accept that we are going through some changes, obviously or non-obviously. So it's also including changes in your sensation. So you might experience numbness in part of your body after surgery, or in your hand and feet, you know, after the chemotherapy, or you might losing appetite. You know, these are all some changes that will occur in your life during the cancer treatment and the recovery journey. And of course, we will be concerning, as this is a webinar for a psychological topic, right? We will be concerning the emotional impacts, you know, behind all these changes. So now I will let Jefferson to talk about the emotional impacts to all of you.
Right. So yeah, thank you so much, Eunice. I actually love how Eunice actually categorize physical change into two categories, which is obvious and the not obvious one. Because when we talked about physical change, we always think about what we can see, but Eunice actually put it very nicely that physical change sometimes occurs to the parts that not the public don't usually see. Even sometimes we as psychologists we don't usually see as well, and that actually causes a significant emotional impact to the person who is actually undergoing all these changes, right? So what are those significant changes to the changes that the person is going through, right? So obviously when the physical appearance is changing, it will affect how the person function in the society. So social anxiety would definitely be something very significant, right? So later on, I will go into further how is social anxiety being manifested for those who has undergoing physical change, right? Next, low self-esteem is also something that is very significant because of how Eunice said, right? So physical change, body image is highly related to your personal self-worth, right? So any changes in this body image would definitely change in your self-esteem as well, right? Later on, when things get out of hand, this person may feel worthless or may manifest anger towards themselves, towards these changes. Okay? Right. So, what I'd like to highlight today is how body image is related to social anxiety. Right? As I mentioned, as Eunice mentioned about some of things that changes, for example, who breast cancer patients who have undergone mastectomy, a removal of their breast, may feel a different in their physical change, in their physical appearance, right? So as compared to other ladies who have breasts, but they may feel nothing, right? So when they want to leave the house, they would feel that hey, they are different. They are they are not they are not like themselves anymore. So what will they do? They will choose to avoid to leave the house entirely because they don't want to see others, and they don't want others to judge them as well, seeing the change, seeing that they are different, right? And this would definitely cause them to avoid intimacy in romantic relationship as well. Like how Eunice have mentioned, right? One of the type of changes is change in sexual life, right? So these body changes would affect their intimate relationship as well. Okay, they'll later on feel ashamed about their appearance. They have negative thoughts about how others are viewing them, right? As you can imagine that if some parts of you are different, so if let's not use mastectomy, or just imagine yourself having no eyebrow. You don't have any eyebrow. Even I cover up right now, right? You would see very weird, very different, right? So how would people actually perceive it? People would see it differently as well. So and when this person who is undergoing change, even I looking at myself now, I will feel that hey, I'm weird, I'm different, right? So they will have this negative thought about towards themselves, and later on, you just avoid meeting people entirely. They'll just isolate themselves, withdraw themselves from social activities. And this eventually leads to social anxiety, right? Another thing that I like to highlight here is how body image influence self-esteem, right? As our self-worth get impaired, get defeated, right? We have low confidence about this new self. Why do I use this new self? Is that change cause something to become something new, like how COVID has changed it and how our life has adopted the new norm, right? So, but people, not everyone, not every single person can adopt this new self because of their low self confidence. They don't feel themselves anymore, right? They may dislike themselves now, or they'll feel angry towards themselves. Why am I like this? Why don't I have hair? Right? Why don't I have this part of breast anymore? Why do I have a stoma bag attached to me? Why do I have this part of colon removed? And they'll feel angry. Angry that why didn't I take care of myself better when I was healthy? Why do I allow myself to go through this process of removing part of me? Okay? And they'll definitely grieve about the losses. It's it's a part of you that is no longer there. Of course, there is a loss. People would grieve over it. Listen to allow yourself to grieve for it as well. And then they'll persistently check themselves in the mirror. They'll see, am I feeling weird? No, when I put on this shirt, does it show that I don't have this part of breast anymore? Okay. If I put on my hat, does it cover up all the parts of my head to show that I'm not bald? Right? They will put on eyebrow, eyebrow what do you call marker, right? Eyebrow pencil. Oh my god, eyebrow pencil. Right? They'll constantly check. Is this right? Is this natural? And then later on, they'll feel that themselves are flawed and different, and this will eventually affect their self-esteem. And you can see how a loss of a person's body part and how it would impact the person's body image would eventually cause so much of emotional impact to this person as a whole, right? So after knowing the emotional impact, so what can a person do in dealing or managing with all this emotion, right? So what if we invite Eunice back again to share with us how can a person actually embrace the new identity beyond the appearance?
Thank you, Jefferson. Actually, for what I totally agree with what Jefferson said just now. I think he put this body image change into a very holistic kind of view. So you can see that it doesn't only affect how you look yourself in a social context, but it also affect you yourself deep down in your heart. How do you see yourself? The self-esteem, the self-esteem level is reduced, after all these changes happen in your life. So now we will be looking at how can we embrace our new identity beyond the appearance, beyond what we have hold on to our life for the past years. So now that we have new identity, I think the first one is we have to be gentle with ourselves and our body. Show yourself some kindness and compassion in these changes. So you need to understand that your body is going through a lot, and it is doing its best to cope with all these changes. Not only you, but your body is also there with you, going through all these changes. And you have to know that it's okay to be not okay sometime, because these changes are very difficult. All of us understand it. Your body also understand. It's very difficult to deal with, and we have to understand that there's no quick fix. Not everything can fix it quickly. And it's okay to recognize that and give yourself some time, the kindness to process it slowly and how you feel about it. I think that's very important. And next, maybe you can start doing some activities that make you feel really good. You know, it can also help you to remember who you are and to see yourself outside of your appearance or your cancer diagnosis or your cancer journey. It's you seeing through your identity rather than the appearance, rather than the amount of hair you have, rather than whether the your skin is tight or not. Changes to your body can sometimes make you feel less you. I understand that, but picking up hobbies, all these activities could be a great way to feel more in touch with yourself and doing things that make you feel happy and confident in yourself can improve your overall self-esteem. Okay, and next one, we have to tune into how we are feeling. So I think we can do this by reconnecting your body through activities like yoga, exercise, massage, or mindfulness. You know, um, when we are doing all this mindful activity, we are actually putting back attention to ourselves, to our feeling, how we feel, how we think of ourselves. Does this, does all these thoughts and emotions somehow affect ourselves? When you are doing all this mindful activity, you might also notice that there are some changes in your bodies, in your body parts. For example, whether you have a smooth breathing process or not, whether your muscle are tense or not, whether your this part, whether your forehead is frowned or not, right? All these things can tell you how your body is feeling at the moment, and it helps you to understand yourself more, your body more. And lastly, I would suggest that we can actually wear what makes us feel good, you know, and there's nothing wrong with wanting to feel more confident in the way we want ourselves to look. Okay, we can just like experimenting with new clothes styles. We can do makeup, we can do hairstyles or wigs, can whatever that can help us feel more empowered. And there's no one way that you should look with cancer. You can decide how you want to present yourself, and buying new clothes or trying a new look could be helpful. Okay, so I guess these are some suggestions that I can give. Now, let's hear from the psychologist. So, Jefferson and I will be talking about when we are working with cancer patients, when they are going through their cancer journey, what are the concerns that, make them feel stagnant or stuck regarding body image? Hi,
Mm.
Jefferson. Welcome back.
Hello. Oh, wow. Okay, I just reached my favorite part of the webinar for today, which is to hear from us. we're sharing our deep dark secrets.
Yes, yes, yes.
Yeah. Right. So hearing from Eunice, right? I mean, she have
Mm,
shared how the self-care techniques that one person can actually practice,
Mm,
when they are going through such difficult time. And I believe what Eunice wanted us to share even more is that how can we psychologists actually support you in addition to how you are taking care of yourself, right? So actually what would happen in a therapy room? Let's say Eunice, so when a client comes to you, right? And they were sharing that, they have difficulty accepting,
mm,
the changes that they are going through since their surgery. So how would you actually first start to address this issue?
mm. Okay, I think this had been a very difficult movement for me, because
Mm,
working in this field, right? Sometimes I might feel a bit lower in confidence level
mm,
because
mm,
sometimes I might feel that I would not have the ability to
mm,
able to empathize my client because they are
mm,
on this journey. They feel really difficult, very hard. They shared to me, and
mm,
I am not in the journey at first.
mm,
At first, I feel like it, and I think when I'm doing this, I'm telling myself that, oh, you are not competent to help your client. It's not good and healthy for me and the client either.
mm,
So
mm,
when this question came to me, I think normally and most of the time I was started with supporting them emotionally.
mm, mm,
Because I think my work, my role is to
mm,
provide a safe space to all of my clients,
mm,
to express and process their feelings about
mm,
any changes in their life. If
mm,
if I'm able to do that, I think they
mm,
will be feeling more comfortable and more relaxed to share anything with me, and we
mm,
can process starting from there.
Yep, so I totally agree that the first step is actually just provide that safe space for them.
Mm,
Because as we have discovered just now, right, is that when a person actually lose part of them, right, they have they don't have that self-esteem anymore, right?
yeah.
And that social anxiety that we were just discussing about. So they came to you and they show the most vulnerable side of themselves to you. So as psychologists, right, the first thing is that we just have to be there for them, right? we
Yeah.
we would definitely not jump into to start intervention or whatever, but being there itself is such a powerful intervention by itself, right? And another thing is that I would definitely allow them to grieve of whatever loss they have gone through,
Mm, mm,
right? Because it's a part of their body that is no longer there. So definitely the person would feel sad, feel a flood of emotion rushing through them. So the very first thing is that just allow them to express their grief, express their sadness over the loss. You know, definitely a person will just jump in to say, "Aya, what you so sad about? It's just hair, ma. It'll grow back one, ma."
yeah.
Right? I believe a lot of us would have heard it so many times, and it infuriates me so much because it's not hair that
Mm,
just lost. It's not just hair. It's a part of it. It's because losing hair signify that it's real,
yeah.
right?
Yes.
It's really happening.
Mm,
It's not just cancer. It's really really happening to you because hair loss is the first thing that you notice after loss.
mm.
Mm,
Wow, I totally agree with what you say, Jefferson. I can feel like, I can feel how much you can feel with the patients, with them
mm,
in this journey, because I think when all your words are very powerful for me, because I think it's very hard to find someone who can sit there with us with our emotions. It's very
mm,
difficult because negative, we humans, right, we are naturally trying to avoid negative things, I guess.
mm,
Yeah, so we'll try to escape anything that cause us feel bad, feel
mm,
not good,
mm,
that's why, many of my clients,
mm,
they would tell me that, oh, you know what, Eunice, actually at first I really don't want to be in the session. I don't want a professional to see that I'm actually losing my hair. I'm actually
mm,
losing one of my body parts. It's very
mm,
hard for them to cross the line, to start
Mm,
seeking for help. Do you
mm,
I'm wondering, do you experience any uh, of these, when your client is telling you
mm,
some of these words?
mm. Yeah,
Mm,
definitely, because again, it's lost, right? It's such a
mm,
significant part of them that it's gone. And definitely we are the person to whom they feel comfortable with.
mm,
Because I believe that always psychologists give out a vibe that we are a comfortable person to talk to. So that is what we are. Our role is actually just to be there. So for those public who are wondering why we are bringing this up, right, it's actually that we want to let everyone to know that it's something really common to happen. And having all these emotions with you, especially for those who have really gone through that process, right, these emotions are common emotions, are common reaction. It's really okay to feel every single thing that is happening to you, right? As Eunice mentioned just now, right, people tend to avoid negative thoughts,
yeah.
because no, who wants to be negative all the time, right? But at the same time, I want to empower a person who are listening is that negative thoughts were there for a reason. They're there to protect us. And we have to really understand why they are there for us. Of course, we have to manage them eventually, but when it happens to you, you have to really be there ready to welcome them for you. Right?
Okay, that's a good one. That's a good one.
Yeah, so we're just talking about self-esteem, how body image relate to that, right? And then I was so amazed that when you say about self-care, right? I feel like
Mm,
a lot is in categorized into self-compassion, you know,
yes.
like
Mm,
being kind to yourself, being gentle to yourself, right? So how can self-compassion be a big part in managing body image issues?
mm. Actually, for me, right,
Mm,
self-compassion is about not only about self-care. It's also about feeling comfortable with yourself,
mm,
um, loving yourself. You
mm,
truly accept who you are.
mm,
It's very hard for us. We have many past issue. Maybe there's some um, unresolved business in our past experience,
mm,
that stop us from truly loving and accept ourselves.
mm,
These are
mm,
something that I am looking into, even for myself.
mm,
Self-compassion is a concept. It's a holistic concept that you
mm,
truly accept who you are, no matter
mm,
how you look.
mm,
These can be
exactly.
practiced.
Right. It's kind of
Mm,
sad that somehow our society actually shape
mm,
every single person to not really love themselves in a way.
yes.
They shape every single person based on how the society will perceive this person to be. Like,
Mm,
if you go to social media, you can actually find a ton of things to compare yourself with, to not love yourself with, right? So the
yep.
society actually made us to not feel, to not love ourselves. And it's really time to come back to us to see that how can we better love ourselves
Mm,
despite going through such significant change. Mm.
agree, agree. But I
Mm,
think
mm,
if the audience want some tips, I think we can always start with the physical care of ourselves,
mm,
knowing that when we are feeling uncomfortable or feeling unhappy, try to do something that makes us feel happy first. I think that's
mm,
very important
mm,
for us to go on to this long journey.
Yeah, I was also agree that that would definitely be the first step. Because
Mm,
you have to bring yourself out from that negative spot first. Right? After bringing yourself out from it, you feel that sense of happiness or satisfaction about yourself. Maybe it's time to really come back to that thought again. Why is it that you are not happy with yourself?
mm,
Is it something that it's making you to feel that you are not happy with yourself? You are flawed in some way. Because that is the underlying issue. That's the core of yourself. That why that you are not seeing yourself as good enough, as beautiful enough, as pretty enough.
Agree. All right. So I guess we have some questions from the floor. So why not we move on and then we can answer some of their questions? What do you think?
Definitely, right. So
Okay.
let's bring in. I mean, rather than just us talking about things, right? Maybe you can ask. Let's hear from our the audience first. Maybe you can add on later on, lah, kan?
Okay.
Okay,
Okay.
so from Skylink Creative, seems like Skylink Creative is someone that is very popular in our webinar, right? So, what advice would you give to someone who is just starting to deal with body image changes from cancer treatment? Somehow it
Okay.
is very similar to what we have shared, lah, right? So maybe
Mm.
you can add on some more, Eunice.
Okay, sure. Just now we shared about, first of all, of course, we have to be patient with ourselves first. We
Hmm.
have to understand that our body actually also with us went through a lot,
Hmm.
in this journey. We went through a lot
Hmm.
of changes. So the first step is always be patient.
Hmm.
We do not want to see our body as a problem and we want to solve it quick.
Hmm.
It's not working like that. So first step is to be patient, and then second is to start seeking a support.
Hmm.
Uh, talk to your friends, your family, or join some support groups that around your living area that you can share your feelings and hear from others.
Hmm.
And if these are you are still having some concerns, why not talk to a professional like us, Jefferson and I. We can help you to go through the process, all the
Hmm.
emotions, and maybe when you listen from different people, not only from your friends and family, your perspective would be changed of all these
Mm,
changes
mm.
also.
Yep, right. So just to add on something, right, for how
Mm,
what Eunice have said, seeking support. Yes, I definitely agree that support is such an empowering thing in our life, right? But also be very careful of who you are seeking support from, right? So as I mentioned, just some people would tend to not be able to understand your situation. So
mm,
those are persons that I would definitely suggest you to not say distance entirely, but be more cautious around them, right? Find people who truly empowers you, right? Who truly understands that you are going through that and are able to be with you for a long time, right? Not just that gathering session that you are going through, right? So
mm,
because a lot of times when people around us they tend to be very worried about cancer patients, right? Of course they'll be worried, so they'll give a lot of opinions, suggestions, their personal thoughts, their personal stories. So you have to be very wary of whether these stories are actually empowering you in a way or not.
mm.
So
Okay.
support system can be the bridge. At the same time, it can actually brings you away from flourishing. So you just have to be very careful, lah.
I feel
But
that.
of course, if I can shamelessly promote ourselves, finding a profession will be the best option.
Yes, of
Right,
course.
right. Very shameless today.
Mm,
Definitely lah. I mean, other than that, right? If you're not ready to seek support, as I mentioned, seeking support from professional can be vulnerable at some time, right?
mm,
So
yes.
just try to educate yourself better. Try to seek other form of support or other form of aid. For example, like if you feel don't feel comfortable, confident about yourself after going through mastectomy, so find some organization that provide prosthetics, that can help you in a way to feel that support. Or actually search online for information. Search legit
Yes,
websites. Legit
with reference.
websites. Yes, with reference. Yes, exactly right. Legit websites to help to gain more knowledge about your current state. Hmm.
Okay, should we move on to the next question?
Hmm. Do we have any next question though?
Oh,
Yes, of
yes.
course. From our dear colleague. Very familiar name as well. How do you
Yes.
practice self-compassion? We were just talking about self-compassion, right? So what self-care routines do you follow? Do we follow? Do we as psychologists follow? Wow, interesting.
I was.
Right, okay, so take it away, Eunice.
Mm. Okay. Well, so for me, I
Hmm.
think I have been practicing mindful activities actually.
Hmm.
So I think because recently I've been experiencing some back pain,
Hmm.
because
Hmm.
due to my muscle tense, it
Hmm.
somehow when the muscle compress, it affect my nerves. So I'll feel body
Hmm.
pain and numbness
Hmm.
sometimes.
Hmm.
So of course, I did some physiotherapy or some exercise to help with myself. But
Mm,
emotionally, when I have physical pain, I feel awful, of course.
mm,
Okay. So I use mindful practice or the relaxation technique to
mm,
help me to sit in with my feelings and
mm,
understand that I can feel pain and I am feeling sad about it. That's what
mm,
I have been practicing. I hope it helps you. In a way, it helps also lah, with the for
mm,
all the
mm.
audiences. Yeah.
Yep, yep. And I think for if I'm to shamelessly share about myself again, right? So what I usually do is I do self affirmation talks.
Mm.
I have
Mm.
a few phrases that I tell myself because previously I was going through a lot of difficulty lah, to actually
Mm.
accept who myself is, right?
Yes, yes,
Because I have gone through some trauma, lah, right? So and I've
understand.
actually gone through so much of growth with self affirmation talks because no
Mm.
one actually would agree on myself other than myself,
Yes.
right? I know myself best and I would know what I want to become, and I know when is my the most confident self, right? So
Mm.
some of the mantras, if I can share, right, affirmation is that I am strong, right?
Mm.
My body is my right. That is the most powerful thing I usually tell myself. My body is my right. No one has any power over me to say about my body.
Wow.
So that is very very powerful that I can imagine because it's like for me the most important thing around my head, right, is my hair. Right? So it's my hair, definitely my hair, right? So a lot of people have different opinions about how I style my hair, but
Mm.
eventually it comes down to how I feel about myself. I feel that this hairstyle, it's when I'm the most confident in. Some people may say that it's very messy, it's curly, right? But hey, it's not their right to judge how I would want to feel. It's
Yeah.
my right. I should take control of whatever things I can feel.
Mm.
Hmm.
I can feel the power coming over here.
Yeah, because again, self-immersion is something very, very powerful. And I
Mm.
would suggest everyone that's listening, right, try to find something that aligns with you, that resonates with you, that
Mm.
can give you a sense of empowerment, gives that powerful meaning to yourself. Hmm.
Okay, I hope this helped, colleague. So can we move on?
Oh, definitely.
Huh.
Hmm. So maybe, Eunice, you can actually go with it.
Okay, all right.
Hmm.
Okay, so to talk about any specific, I think
Hmm.
Hazi is asking if there are any specific strategies to
Hmm.
improve self-esteem when dealing with body image issue. I
Hmm.
think this is also one of our topic for today, right?
Hmm.
So um, how to improve or boost your self-esteem is something that us as human we always want to find because self-esteem is very important,
Hmm.
not only in workplace, not only
Hmm.
in one setting, but it's
Hmm.
very important in every single setting because
Hmm.
that's anything happen to your self-esteem, your beliefs, everything will collapse, right?
Like your
So
self-worth that we have been talking about, right?
yes, yes, you are right. So I
Mm,
think for me, the specific strategies, and I think as a layman, as a normal people, we can use. I think I buy the idea that Jefferson was talking about the positive affirmations
mm,
every day, at least telling yourself one significant sentence that can boost your self confidence, self esteem.
mm,
I think
mm,
that would be the first step that you can do.
mm, mm,
Maybe just now when Jefferson gave some examples of the positive affirmations, right? Maybe
mm,
from myself, I can also give some affirmations also.
mm,
Some of the example.
mm,
So, for example, I am worthy of love and respect. I
mm,
embrace the change in my body with compassion and grace.
mm,
Or I am strong and my body is capable of healing.
mm.
You know,
Yep.
when you say it out instead of thinking them, I think this make a difference.
Exactly. Right. That's the purpose of self-affirmation. You have to affirm yourself, right? Not to self. It's not self-thinking. It's
Yes.
self-affirming, right? You have to affirm. You have to be strong in affirming that. So another thing is that I would like to. What I usually used to do is that every morning when I wake up, right, I will look in the mirror and I do 3 smiles in front of
Oh.
the mirror. So I will smile once and then
Mm-hmm.
I'll be normal. Then I'll smile again. And then when the third time I'll smile, right, it's something very natural. You don't
Oh,
have to force yourself to smile anymore. It's something
wow,
that you
that's
just smile.
interesting. Wow,
Mm,
I
mm,
should practice that too, I think. Thank you for giving me that idea.
Because I actually learned it from one of the book that I've read, which is to really be natural
Mm,
about your body, right? It's like how Hazi has questioned, right? To improve self-esteem. So I
mm,
would somehow disagree that we don't need to improve our self-esteem.
yep.
What we need is that we need to find our self-esteem. Because everyone has self-esteem. We don't have to so-called boost our self-esteem. We just have to find back our self-esteem. And
Okay.
by smiling, it just allows you the self-esteem to just radiate out naturally on a rated smile.
Wow, that's a good one. That's a
Mm.
good one.
Well,
Okay.
today I'm on fire with all these philosophical phrases.
Wow. Yes, you are. You're having many good ones.
Right, right. I'm so tired today. Maybe my tired brain just fired up with all those physical, philosophical phrases today.
I'm glad that you're here today then. Okay.
So hopefully, Hazi, we can, those can actually help you to improve or actually search for your self-esteem.
Mm,
Next question, if we have
yes.
any lah.
We
Ada.
have.
Okay.
Mm.
Okay, by David Yu. So how do you, with the capital U, get the cancer patient to open up their emotions and frustration on a face-to-face session? Such a
Wow.
struggle, right? It
Yes.
is such
And
a
this
struggle.
person is trying to dig our work out,
Right,
He's
right. They're
trying
trying
to
to
know
get the
what we
secrets
do.
out of us now.
Yes. Yes. Okay. Do you want to open up to him?
Well, I mean, we couldn't say no, right?
Okay.
I mean, it's good that we share this because again, these are
Mm.
not secrets that we only gatekeep to ourselves, right?
Yes.
Everyone should learn how to actually open up to their
Mm.
friends, to their family about how to engage them to express their emotion.
Agree.
First thing I would always do, like I think just now we have been talking about, give them that safe space.
Mm.
Give them that feeling that they are safe to open up their emotion,
Mm.
right? Definitely, there are people who came into the session and just sit there. They will not talk to them. And we will ask them, how do you feel? They said, okay.
Mm.
They
Yep.
just do that. They would do that. And you would feel that, oh no, they are the quiet ones. Oh no. Right.
Mm.
And what I really adopt over the years is that silence is very powerful.
Agreed. Totally
Mm.
agree with you. Yeah.
Yes. Last time when I was still fresh, still young, right? I couldn't bear silence at all. 1 second, I was like, no, I need to say something now. I need to ask further. No, what do you mean you're okay? But later I realized, right, just be silent. Just stay with them.
Mm.
You don't have to stare at them. You just look at them. Gently look at them. Allow them to slowly open up. They will eventually slowly open up to you. Right? Opening up an emotion, right, shouldn't be forceful.
Yep.
Shouldn't be forceful. And if you're forcing someone to open up their emotion, means that it's wrong.
Yes.
It's something wrong already, right? Even when they open up, they wouldn't be genuine because they're forced to open up, right?
Mm.
So allow them to sit with them, accompany them. Eventually, they will open up.
Okay.
They will express their emotion.
Mm.
Mm.
Maybe I can add on
Mm.
one analogy that I can think of.
Mm.
Actually, for a person to open up your emotions and frustrations, I
Mm.
guess the process is like peeling the onion.
Mm.
When we are peeling the onion, the spiciness will come into our eyes
You start
where we'll
crying.
start crying, right? So this is the process. That's what I have experiencing right now. Peeling
Right.
peeling the onion, then you will see the true self, the person
Mm.
who show the true self at the end of the day.
Right.
Mm.
Exactly. And if I can imagine myself peeling the onion in reality, right, I would be quietly peeling the onion. I wouldn't be, how should I peel this onion? Should I put it this
Oh my
way,
God,
that way?
so spicy.
Yeah, we wouldn't talk anyway. When we are
Mm,
cutting the onion, we are peeling the onion, we are quiet in
yep.
reality. So same goes in therapy session when we are allowing them to peel their onion or we are peeling the onion for them. It involves silence. It
Mm,
involves the natural process. Okay?
yes, agree.
Right. Definitely it will be very uncomfortable to be in silence, when you
Yes.
guys are watching each other. Imagine now we are just watching each other. Right? I couldn't tahan anymore because it's really, to be honest, it will be uncomfortable. But later on, you realize that it's so much powerful than talking, than asking them to open up.
Mm, okay.
Right? Okay, next question.
Yes, we should move
Hopefully, you
on.
answer that question, lah, kan?
Anything can
Hmm.
let us know, okay? Wow, this is a
Oh,
very
for our
long message.
wonderful Kai. Wow, sounds very familiar again.
Yes.
Mm. Wow, very insightful sharing. Thank you so much, Kai.
Thank you.
I have a question here. Okay. A lot of cancer patients may fear that their partner will dislike the changes to their body after surgery and become distant, which affect their sex life. Wow,
Mm,
very long question. How
wow.
can partners provide support and reassurance to help their loved one feel more comfortable with their post-surgery bodies during intimate moments? My God,
Wow.
Kai, that's such a long question, girl. You're not here, but then you're asking so much question. Okay, but it's a very important. It's such a good question to ask, right? Because it involves the things that the society usually don't talk about as well. It's a taboo to talk
Mm,
about intimacy and talk about sex life, right? So again, because of this taboo, we have to bring up the elephant. We have to drag the elephant out of the room.
yes, for sure.
So how do we actually support them and provide that reassurance that it's comfortable? It can be comfortable when it comes to post-surgery bodies.
Mm,
Any
that's
thoughts,
something.
Eunice?
Yeah, I think I can think of something that what we
Mm,
have been sharing just now.
mm, mm,
When this taboo is there, when everyone is trying to ignore them, right,
mm,
and everyone is keeping quiet with that, maybe
mm,
let's just sit with the silence and think of it. Is
mm,
if this is something very important in your life, in this room,
mm,
what
mm,
can we think through it? What can we do about it? Do you
mm,
want to do something about it?
mm,
What can you do about it if you want to do something about it?
mm,
I think giving the safe space for the silence is very important
mm,
in this issue, I guess.
Yep, yep. And I feel like because they are your partner, right?
Mm.
So you should. I'm using a very strong word here. You should, right?
Yes.
You should actually be comfortable with these changes as well.
Mm.
And if you are not comfortable, how would you expect the person who has gone through surgery be comfortable with you?
Mm.
So both parties has to be comfortable with these changes. That's what I would think of. Because
Okay.
if let's say if example is that the female has gone through mastectomy, and if the male is uncomfortable seeing a part of their partner's breast has been
Mm.
removed, how would you expect this female to be comfortable in front of this partner?
Mm. Agree.
Hmm. Right. So the partner has to know about themselves as well.
Mm.
Hmm. Hmm.
I
And
think
that
it's a
is.
mutual
Hmm.
work, right?
Yep, yep. It shouldn't really put the reliance on the person who's gone through the surgery to
Mm.
figure out a way to feel
Yeah.
confident about themselves or
Yes.
to go through more surgeries to implantation
Mm.
just to make their partner feel comfortable.
Mm.
Both has to be come together as a unit in this case.
Yeah. But I
Hmm.
think if at the end of the day, really, both of them, they really can't see that any way that can be done with this issue. The best way is
Hmm.
to find a couple therapist to help.
Hmm. Hmm.
Mm.
Hmm.
Seek help from the professional isn't something very weak or
Hmm.
means that you are useless, but it's show that we are willing to work something together
Hmm.
as a
Hmm.
couple. Mm.
Yep, yep, yep. So again,
Okay.
it's really important to acknowledge what we have gone through,
Mm.
and your
Yeah.
partner should take that effort to acknowledge as well, in order to provide that safe space, that supportive space.
Thank you
Right.
for asking that, Kai. If you have any concern, let us know. We can have a session for that.
Right. I believe we have a number here, right? So shamelessly, shall we put on our number so that people would know where to approach us?
Okay, sure. You can put on the slide.
Right. So, right here is our contact number, right? But I believe that Eunice actually prepared such an amazing slide, and I feel that we cannot miss out one of the very amazing slide that she prepared, which is this quote. So Eunice, take it away.
Okay, thanks,
Take
Jefferson.
the honor. Take the honor to talk about your quote.
All right. So
Mm,
today for today's webinar, I think the message
mm,
that I would like everyone to take away for from today is
mm,
my body had carried me through a hard life. It looked exactly the way it's supposed to. I
mm,
think this is the word that we have to bear in our mind that
mm,
me and my body went through something together. I cannot live without my body. So it
mm,
looked exactly the way it's supposed to. It will be an affirmation to you and your body too. This is something that I would
mm.
like to share with everyone today.
Yep, exactly. So the person or the thing that you can rely the most is actually your body, nothing
Mm,
else. Because your body has been with you since you are a baby in your mom's womb, and it will follow you through every single experiences that you have gone through. And it, as here mentioned, it looks exactly the way it's supposed to be.
mm.
Wow, amazing today. Feel like today is filled with philosophical thoughts. I believe our audience will be like thinking a lot today. Such a struggling webinar to go through today, everyone.
Oh,
Imagine nighttime we still want you to think philosophical thoughts. Okay, so
okay.
before that, right, we just want to say thank you, everyone. And if, because other than just providing our services, we also have a mental screening. So I believe that link will be posted somewhere in our comment. So feel free
Mm,
to join our mental screening just to, as a gateway lah, for you to go into therapy. Yeah, okay, our code is here, right? So feel free to scan, feel free to approach us, and we can actually work together. Provide that support, that supportive space to you, right? Okay, wow, oh my god, Eunice, today I feel so tired after the webinar today, wait.
yes, my brain feels so tired. Like I have a brain fog now.
Right, exactly. And tomorrow we have another one. We have another one in
Oh,
Mandarin.
yes,
Can we survive that, Eunice? But we have to survive through that, lah,
we
kan?
have to. It's a very
Right.
heavy word, but we have to.
Yeah, we have to, right? So for whoever who is interested or that knows that someone would benefit from our webinar and can learn more in Mandarin, tomorrow we have another one exactly the same with Eunice and I, right? We'll be sharing the same thing but in Mandarin, right? So the same time at 8:30.
Okay.
Right, okay, oh my god, Eunice, thank you so much for inviting me and thank you so much for preparing the wonderful slide and topic. Wow, such an amazing journey with you today.
No worries. Thank you so much for joining too, Jefferson. I hope
Right.
tomorrow we can wrap up everything in a
Mm.
good show. All right.
Right,
See you
right. And hope that
tomorrow.
our momentum can continue until tomorrow, yeah?
Sure. Okay. Bye
Right.
bye, guys.
Right, bye everyone.